Hi, this is Nicole Wade, and this is my head-to-toe assessment for Presentation College. Knock, knock, knock. Good morning, Joe. My name's Nicole. I'm going to be your nurse today. I'm going to go ahead and wash my hands real quick and give us some privacy. Can you go ahead and state your name and date of birth, please?
Joe, 11282.
Okay. And if you had a name band on, I'd also double-check that there. Today, Joe, we're going to go ahead and give you a head-to-toe assessment, and this is just going to give me a better idea of how to take care of you throughout the shift. So, can you tell me where you are today or the date? Either one.
Oakdale.
Okay, great. This makes us, or allows us to know that you're alert and oriented. And so you're about 28 years old. It looks like you're in great nutritional health. I don't see any body deformities. Speech seems good. Mood and affect is fine. So I think we're good to move on. Throughout this exam, I'm going to be checking your skin in all areas. I'll be checking for the color, texture, moisture, the skin turgor for hydration, and pigmentation. So I believe we'll go ahead and get started. I'm going to start with your head. Excuse me, I'm going to look at your scalp here. And I'm looking for just normal, nothing dry, no cuts, no lesions, deformities, anything like that. Everything looks good there. Then I'm going to check the hair for its texture and note any thinning or balding or baldness, which you have some, which is normal for men as they age. Then I'm going to just palpate the cranium here. And we're looking for any type of deformities or abnormalities, and also checking for symmetry. Everything looks good there. So I'm going to go ahead and move on down to your face. And again, I'm looking for symmetry here, that the eyebrows align, nasolabial folds, and sides of the mouth. Everything looks good there. I'm going to go ahead and palpate your temporal artery. Great. And your sinuses here. The line below the eye. You'll let me know if you feel any pain or tenderness. Then I'm going to go ahead and check your jaw here. I'll have you open and close. Great. That should be a fluid movement, no clicking or snapping. And yours does that just fine. Then I'm going to go ahead and check for lymph nodes. We're checking in front of the ears, at the mastoid process, down at the base of the skull, sides of the neck, and right above the clavicle here. And all of those are good. I'm going to have you go ahead and smile and show me your teeth. Puff your cheeks out and raise your eyebrows. Great. And that's showing our cranial nerve 7. Then I'm going to test for some range of motion. So I'll have you go ahead and tilt your head forward, and then from side to side. And then I will have you push on my hand. Great. Shrug your shoulders up. Good. Touch your ears to your shoulders. Tip your head all the way back. And then push it away from my hand. And again. Good. Okay, so we've moved on. That's our face. We're going to go ahead and move to the eyes. And we'll start with our Snellen chart. I'll have you cover one eye and read. This one will hold about 14 inches from the eye. And read the smallest line you can.
428739 EWM00X.
And then the other eye.
428739 EWM00X.
Okay, and that is 2020. Main thing to remember with Snellen charts is the larger the denominator, the poorer the vision. On this card, it's also going to help us gauge the pupil, giving us a size chart here. So we'll have you look in, depending on how much light We're right at about a 5, which is good. Before I set this down, we're going to test your visual field. So I'm going to have you take this and cover your eye here. And you just let me know when you can see my finger.
There. There. There.
Great. Good job. Alright, I think we're done with this. I'm going to go ahead and palpate your eyes. I'll have you close and open. Good. I'll have you look up, and I'm checking your conjunctiva here. Look down. That should be pink and free of exudate. The sclera of the eye should be white, and it is. Alright, then we'll go ahead and check for accommodation. I'll hold my finger about 4 inches from your eyes. Focus in on my finger, the wall behind you, and then back on my finger. Great. And as the pupils focus back on my finger, they should constrict, and they both do. All right. With that, we're going to go ahead and do our 5-point gaze. So I'll have you follow my finger. Good, and that's checking our extraocular muscles. Now I'm going to grab my ophthalmoscope here. And from about 12 inches away, I'll have you stare straight ahead. Point this at the bridge of your nose, and I'm just checking that the cornea reflect the light in the same spot on each eye, and they do. Then I'm going to move from the side here. And as the light enters this eye, this pupil is going to constrict, and the other side will also constrict simultaneously. Another for reaction. Good job. Okay, after all of that, I'm going to go ahead and look at the internal eye. So I'll have you stare straight ahead. From about 15 inches away. So that's about right. Great, and then move a little closer. Good. Pupil should reflect a red light when we're looking, and then as we move closer, we'll be able to see our optic disc, which is yellowish, see our retinal vessels, and our macula. Everything looks great there. We've tested our vision. And now we're going to go ahead and move on to our ears. Let me grab all the stuff I need for that. Okay. So first we're going to check that they're midline. Or line with the eyes. And they do. Then we're going to go ahead and palpate. And I'm feeling for thickening, tenderness, sores or lesions, any pain. All right, then we're going to do a couple tests. I didn't grab this. Here we go. First, we're going to do our whisper test. And I'm going to do this while occluding one ear and wiggling my finger and whispering a 2-syllable word. And I'll ask my patient to repeat that.
Christmas.
Great. Then we're going to go ahead and do our Weber test. We're going to use our tuning fork. And can you feel the vibration in both ears?
Yes.
Okay. Then we're going to step onto the back. This one I'm going to go ahead and strike the fork. I'm going to place it on the mastoid process. You tell me when you can no longer feel the vibration. Then I'll move it in front of your ear and you can tell me when you no longer hear the vibration. Jeez. There we go.
All right.
Okay.
All right.
All right. 7 and 18, which is good. Bone conduction is the mastoid process, air conduction right in front. Air conduction should be twice as long as bone conduction, which it was, so that's good. All right, after those tests, I'm going to go ahead and look at the inner ear. First, I'm going to go ahead and just look at the outer canal. Right. And we're just looking for any type of sores, drainage, occlusion, such as earwax. Then we're going to look in at the eardrum, and it should be, like a pearly gray color. And that looks good. We'd be looking for any type of swelling, inflammation, drainage, bright red, things like that with ear infection. And I don't see any. Okay, so after our ears, I'm going to go ahead and move down to our nose. And I'm going to go ahead and just look for symmetry again. Nasolabial folds are even and equal on both sides. We'll go ahead and look for any type of lesions, palpate the nose here. All of that's good. Then we'll look for any type of occlusion of the nose. So I will have you just take a deep breath and exhale. And exhale. Great. While we're doing that, we're going to go ahead and test our sense of smell. I'll have you close your eyes. And pass this under your nose. Can you tell me that smell?
Coffee.
Okay. Good. Then we'll go ahead and look at the internal nose. All right, and we're just looking that the mucosa here is just pink and moist. And we're looking at our turbinates and septum. Septum shouldn't be deviated unless also already noted on health history. And our turbinates should not be inflamed, swelling, exudate, or any type of polyp. All of that looks normal. All right. Now we're going to go ahead and move down to the mouth. And here I'm going to have you just clench your teeth. Good. And we're just checking for a normal bite there. I'm going to palpate the lips. Checking for sores or lesions, and that's good. Then I'm going to go ahead and look inside here. I'll have you open. Oh, wrong way. Okay. And oral mucosa should be pink and smooth. Looks good. Then I'm going to have you go ahead and say ah. All right. And we're looking for uvula movement here. And also the size of the tonsils. Tonsils can be rated from +1 to +4. +4 being that they all the way touch each other. Yours is probably about a +1 to 2, which is within normal limits. The movement of the uvula is testing cranial nerve 9 and 10, I believe. From that point, we're going to go ahead and have you just stick your tongue out, right? And we're looking for symmetry and that there's no tremors there. That looks good. Then we will have you push. I'll have you open and push on the side here. Great. I think that was testing cranial nerve 9 and 10. Not positive. One of them was. And then we're going to go ahead and do the gag reflex. So I'll have you open. Great. Good gag. All right. That's our mouth. As we move down the neck, we'll just check our tracheal midline here. Everything's symmetrical, and that looks good. All right. Done that. And we'll go ahead and move to our posterior chest. So I'll have you take your shirt off and come around the table here. So once again, we're going to look for symmetry. So I'll have you take some breaths, and we'll watch the shoulders rise and fall together. All right. Then we're going to go ahead and palpate for any tenderness or lumps. Then we'll palpate our spinous processes. And these should be evenly spaced and non-tender. Good. And then I'm going to palpate your thyroid gland. So I'll have you lean to the right. Okay. Good. And then forward and swallow. Great. All right. After that, we're going to go ahead and do our tactile fremitus. And when I place my palms on your body, just tell me, repeat the words 99.
99. 99. 99. 99.
And we're just feeling for equal vibration on both sides of the body with that. After that, I'm going to do symmetrical expansion around the 10th vertebra here. And I'll pinch a little bit of skin. I'll have you take a deep breath. Great. And I'm just watching that my thumbs equally rise and fall together. All of that looks good. Okay, now we're going to go ahead and percuss our lungs. And I'll start. Great. And after that, we're going to do diaphragmatic excursion. Excuse me. I'm going to need a pen. Here. Okay, so first I'm going to have you take a deep breath in and exhale. And from the scapula down, I'll palpate till I hear dullness. And I'm going to mark that spot. Then I'm going to have you take a deep breath in and hold. Great. And from that spot, I'll move down again until I hear another sound of dullness. And what I will then do is measure these points. We're right at about a 6, and I believe about 3 to 6 should be right about average. Okay. After percussing and doing our diaphragmatic excursion, I'm going to go ahead and also take the lungs bilaterally. So I'll just have you take some breaths. Great. And we're looking for any type of cracking or wheezing or stridor. Oh, that sounds good. Okay, then I think we're going to go ahead and move on to our anterior chest and cardiac. So I'll have you come around. Great. And I'll actually have you just lay on down. Grab a few things here. Do I need this yet? I'm not sure. Let's start going this. Okay. So first we'll go ahead again and look for symmetry of the chest. And we'll watch for any type of labored breathing and respirations there. Everything looks normal. We're going to have our patient at a 30-degree angle. I think we might try and just prop you up slightly. Okay. And first we'll do jugular distension. Here I'm going to go ahead and locate the jugular vein on the neck here. And we're going to watch for the point of highest pulsation. Once we have that point, we're going to find our sternum. Okay. we'll place our card here. And we're going to measure at an angle to the point of highest pulsation. And we are just above 1 centimeter, which is within normal limits. All right. Okay, from there I think I'm going to come back around the table here. And I'm going to start by doing some palpation. I'm going to palpate the carotid arteries, one on each side of the neck. Okay, and I'll palpate our apical pulse. Good. I'm wondering if there's anything else I need to palpate. Off the top of my head, I can't think of. After that, we're going to go ahead and listen to our heart for rate and rhythm. And we want to just make sure that the rhythm's normal. We're hearing normal S1 and S2. No arrhythmias. And we'll take our rate for 30 seconds and we'll multiply that by 2. We've got a normal rate. Alright, and pulse is 80. Great. Alright, we'll go ahead and listen at all, at the 5 points where we'll find our valves. First will be located second intercostal space right of this sternal border. Second will mirror that on the right side of the sternal border. Then down from there at the 3rd, and then the 4th intercostal space, and then again at the 5th intercostal space, but at the midclavicular line. We'll do that with the bell, with the diaphragm, then the bell. Alright, those sound great. Alright, then I'm going to palpate for tactile phremitis. So once again, when I place my palms, I'll have you say 99.
99. 99. 99.
Alright. And we'll also palpate for symmetrical expansion again. Have you take a deep breath. And exhale. Great. Alright, after that I'm going to percuss the lungs. Great. And then we will go ahead and listen to breath sounds. Okay, And I'm going to also check for a carotid bruit line here. And I don't hear that. Okay. Then we'll have you go ahead and sit up, and we're going to check for heart murmur. All right, and then we'll have you do this by just leaning forward slightly. Okay, great. All of that sounds normal. All right, and then if we had a female patient, we'd go ahead and do a breast exam at this point. I know it said that we could do that possibly on a model if we got that in the kit. And that didn't come with this kit, so I'll just walk you through that. For self breast exam, we'll want the patient to know that you should usually do this about 7 to 10 days after your period begins, not while or during ovulation. For postmenopausal women, you'll pick one day and do it the same day each month. You can look for any type of dimpling in the skin, which can be a sign of changes, by raising the arms above the head. Otherwise, we'll go ahead and palpate, and we're going to use small kind of circular motions in a rotating circular motion, starting from the outside and working inside. We would do that all the way up to the nipple, and then make sure that we extend the breast tissue all the way up. The breast tissue extends all the way up into the armpit, so we'd make sure that we'd palpate in that region as well. All right. After that, while I have you sitting up, I think we'll go ahead and work on our upper extremities. Here we'll go ahead and look again at skin, warmth. I'll ask if you have any numbness or tingling here. And then I'm going to go ahead and check our pulses. Check radial pulse. Great. Radial pulse. Brachial. Right, wonderful. And then we'll do some range of motion. I'll have you go ahead and raise your arms up above your head and down, and then all the way from the sides and up. Great. And elbows will do like this, then all the way out. And wrists will bend up and down. And we'll do some circles. Okay, for our thumbs, we'll bring them all the way in and all the way out. And fingers will touch to our thumb. And then we'll also go like this. Great. All right. We will also go ahead and do motor and muscle strength. So we'll start with the biceps, and I'll have you kind of clench your fists. You'll pull up. Great. Straighten your arms all the way out and push down. Great. Let's see. Wrists. I'm going to push down while you push up. Great. And opposite. Good. I'll have you stretch your fingers all the way out and try and push those together. Good. Let's see. I'll have you flip your hands over, and I'll have you grasp here. That's testing our hand strength. Great. And then we'll go ahead and have you put your thumbs to your pinkies, and I'm going to try to pull through. Good. All right. All of that is good. Then I'm going to ask you to do some rapid alternating movements for me. So we'll start by patting, and then flip our hands out and palms down, and then try and increase that pace. Great. And that should be able to be done sequentially and together. Those look good. Now, I'm going to have you, we're going to go ahead and do some sensory neuro. And I need this. Okay, so first we're going to go ahead and start with our light touch. So I'll have you go ahead and close your eyes. And you let me know when you can feel this.
there, 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 there.
Great. And then we'll do our pain sensation between sharp and dull.
Sharp, dull, dull, sharp.
Okay. And we'll do a vibration test. Tell me if you can
I do.
feel that. Okay. All right, then we're going to do stereognosis. I'm going to place something in your hand and you tell me what it is. Keep your eyes closed.
Coin,
Okay. And then graphesthesia. And I'm going to trace a number in your hand and you tell me what that is.
3.
Good. All right, we've done all of that. All right. From upper extremities, I'm going to have you go ahead and lay down and we're going to move on to your abdomen. Okay. I'm going to grab a couple little tools here. This is all I'll need. Okay, so again, we're going to look for symmetry. We'll look at the umbilicus. We'll look at contour. And we'll also look for pulsation. All right, then we're going to go ahead and oscillate all four all four quadrants for vowel sounds. Then we will percuss those vowel sounds and palpate. Okay. All right. Let's go ahead and percuss. Great. And then we'll palpate. I'll also palpate our aorta while we're here. Great. And we'll do light palpation in all four quadrants and then deep palpation. Great. I'm going to also check and auscultate my aorta for any bruit, which would not be good. Let me get my bell going. Here we go. And I don't hear that, so we're good. All right, now we're going to go ahead and measure our liver. So I'm going to percuss from the lung area down, and I'm going to be listening for dullness. Okay, and I'm going to mark this spot. And then I'm going to go ahead from the umbilical line and back up until I hear dullness again. Great. And then I'm going to measure this line and the distance. And we're right at about 5 centimeters, which is normal. Should be about, I think about 5 to 12. So we're in a good range here. After that, we will go ahead and palpate the liver. I'm going to go ahead and place a hand behind your back and have you take a breath and just exhale. Okay. Then I'm going to come around to the other side and we'll palpate our spleen. And the spleen usually sits a little under the rib here, and it should not be palpable. So I'll have you take a deep breath and exhale. All right, and I am not palpating that. Well, not feeling it. Then we're going to go ahead and also palpate for our kidneys. We'll move our hand that's going under right underneath the waistline here. And have you take a breath and exhale. Right, and we'll move our hands closer together. Great. All right. After our abdomen, we're going to go ahead and move down into the inguinal area. In this area, we'll go ahead and palpate our femoral pulses and our inguinal lymph nodes, both the vertical and horizontal chains. Go ahead and do that. Femoral pulse is often found kind of just right in this, on the pubic line here. Okay, and that's nice and strong. And from there, I usually just kind of move right, and I can start feeling that horizontal chain of lymph node. And then down from there and back behind the leg, I can feel the vertical. All right, and then we would once again go ahead and do a testicular exam. I won't do that on the patient, and like I said, we don't have a model today, so I'll just walk you through that. It's easiest done when standing up. The scrotum is free hanging, and we'll just gently pull down on the testicle and roll that between the fingers, just feeling for any abnormalities. All right, from there, we are going to go ahead and move down to our lower extremities. So I'm going to go ahead and again look at the skin temperature. I'm going to look at the nose, the toes, and between our toes here. We can test for capillary refill. We'll go ahead and check for edema. We'll check for that. You can check on the calf here and also in the foot. If there's edema, we'd want to rate that from 1 to 3, depending on how long it takes for the indent to come back to surface area. After doing that, I'm just going to ask if you have any numbness or tingling in your legs or feet.
No.
Okay, great. And we'll go ahead and start with some range of motion. So we're going to start with the hip. We'll have you bring your leg all the way up and as forward as you can. Okay, and we'll stop when we feel resistance. Okay, all the way down. Then we'll bring it back up, bend, and we're going to come out to the side and stop at point of resistance. And we'll take it over and we'll stop at point of resistance. Great. For the knee, we'll come all the way back out, come all the way up, and bring in as far as we can go. Great. And extend all the way out and flat. Great. For our ankles, we'll have you go ahead and point your toes and flex your feet or bring your toes back. Great. We'll try and do a little bit of an inward rotation and an outward rotation. Okay, great. Okay, and then I'll have you do some circles. Good. All right. Now, while we're here, I'm going to go ahead and check our pulses. All right. This is the patellar pulse, which is great. Our dorsal pedis pulse. And our anterior tibialis pulse. Great. All of them are nice and strong. After that, I think we'll have you go ahead and sit up. And we'll do some strength and motor tests. So I'm going to go ahead and have you just push up. Great. And I'll have you pull back. Good. And push out. Great. That was my ankle. I'll have you push up on my hands here. Good. And down. Great. I'll also have you push in while I'm pushing out. Great. And then opposite. Good. All of that looks great. So now I'm going to go ahead and do our sensory, and then I will move on to our reflexes. All right. So with your eyes closed, just let me know when you can feel this.
There. 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 There.
Great. And we'll do pain again. Dull or sharp?
Dull. Sharp. Dull. Sharp.
Okay. And we'll do vibration. Jeez, I'm having a hard time with this. There we go. Can you feel that? Okay, great. All right, then we'll go ahead and do our reflexes. Right under the knee here. Great. And we'll do on the Achilles tendon here. There we go, got a little jump. And then down on the bottom of the foot here. Right. All right. After that, I'm going to have you go ahead and stand up. We're going to move on to some musculoskeletal. So we're limited in our space here, but I'll have you just walk normally over here. All right. And we're just making sure that the gait is normal and fairly even. The arms may sway slightly at the sides. Then I'll have you do heel to toe, back this way. Great. And you should be able to see some good balance there. Then on your toes, back this way. Great, and then your heels back this way. Great, then I'll have you do our Romber's test with your feet close together, all the way together, hands down at your side, close your eyes. All right, and we're just looking that the patient can hold their balance real good. Slight swaying is normal. Then I'll have you do like a shallow knee bend. Okay, a little bit of cracking of the knees. And then we'll have you go ahead and try and touch your toes, or as close as you can. And while you're doing that, I'm going to trace down the spine. And I'm just looking for any type of abnormal curvature, and I don't feel any. All right. So at this point, I think I've gone through the head-to-toe assessment as best I can. I hope I didn't forget anything. We'll see. Yes, so Joe, I'm going to head out. We've completed our head-to-toe assessment. Is there anything else you need before I go? Okay. And we've got a call light here if you need to get a hold of me for any other reasons. Otherwise, I'll be in and out throughout the shift. Yeah, so then I will go ahead and head out. I'll wash my hands when I'm done. And I believe that's it. So this is Nicole Wade, and that is my head-to-toe assessment. Thank you.